What is the nurse priority when caring for a patient after a bronchoscopy? Monitor for chest pain, assess for gag reflex, check bowel sounds, monitor IV site. Correct answer is option B, assess for gag reflex. Which type of shock is characterized by increased cardiac output and decreased systemic vascular resistance? Cardiogenic, hypovolemic, neurogenic, septic. Correct answer is option D, septic. The best indicator of effective CPR is palpable carotid pulse, normal ECG rhythm, decreased oxygen saturation, reactive pupils. Correct answer is option A, palpable carotid pulse. A patient with a C6 spinal cord injury is at risk for renal failure, autonomic dysreflexia, seizures, deep vein thrombosis. Correct answer is option B, autonomic dysreflexia. Murphy's sign is used to assess kidney stones, pancreatitis, appendicitis, cholecystitis. Correct answer is option D, cholecystitis. Which heart rhythm requires immediate defibrillation? Atrial fibrillation, ventricular tachycardia with pulse, asystole, ventricular fibrillation. Correct answer is option D, ventricular fibrillation. Which sign is most indicative of early hypovolemic shock? Cyanosis, decreased urine output, bradycardia, bounding pulse. Correct answer is option B, decreased urine output. What does a sudden onset of severe headache and stiff neck indicate? Brain tumor, stroke, seizure, subarachnoid hemorrhage. Correct answer is option D, subarachnoid hemorrhage. Which sign is characteristic of Cushing's syndrome? Moon pace, bronze skin, weight loss, hypotension. Correct answer is option A, moon phase. Which side effect is commonly associated with ACE inhibitors? Dry cough, hypoglycemia, bradycardia, constipation. Correct answer is option A, dry cough. Which symptom is most specific to Parkinson's disease? Tremor at wrist, muscle pain, seizures, blurred vision. Correct answer is option A, tremor at wrist. A patient with liver failure develops confusion. What complication should the nurse suspect? Hypoglycemia, hepatic encephalopathy, cerebral edema, sepsis. Correct answer is option B, hepatic encephalopathy. Which acid-base imbalance is expected in prolonged diarrhea? Metabolic alkalosis, respiratory acidosis, metabolic acidosis, respiratory alkalosis. Correct answer is option C, metabolic acidosis. Which lab value is most directly affected by dehydration? Hemoglobin, calcium, albumin, sodium. Correct answer is option D, sodium. What is the purpose of incentive spirometry post-surgery? Pain relief, prevent pneumonia, improve appetite, prevent constipation. Correct answer is option B, prevent pneumonia. Which condition most commonly causes pulsus paradoxus? Cardiac tamponade, mitral valve prolapse, aortic stenosis, ventricular fibrillation. Correct answer is option A, cardiac tamponade. Which sign is a classic symptom of appendicitis? Rebound tenderness at McBurney's point, left lower quadrant pain, hematuria, persistent vomiting. Correct answer is option A, rebound tenderness at McBurney's point. Which complication is a priority to monitor after a ferrosynthesis? Hypoglycemia, bleeding, hypotension, infection. Correct answer is option B, bleeding. Which blood test best indicates kidney function? Uric acid, creatinine, ALT, bilirubin. Correct answer is option B, creatinine. What is the earliest sign of increased intracranial pressure? Bradycardia, decreased LOC, widened pulse pressure, dilated pupils. Correct answer is option B, decreased LOC. Which medication is used to reduce intracranial pressure? Mannitol, morphine, atropine, lorazepam. Correct answer is option A, mannitol. Which assessment is critical after thyroid surgery? Voice quality, blood glucose, bowel sounds, none of these. Correct answer is option A, voice quality. Which sign suggests a hemorrhagic stroke over an ischemic stroke? Gradual onset, headache and vomiting, facial drop, slurred speech. Correct answer is option B, headache and vomiting. Which vitamin enhances iron absorption when taken together? Vitamin C, vitamin D, vitamin B12, vitamin E. Correct answer is option A, vitamin C. What is a primary nursing intervention after a lumbar puncture? Keep patient in high Fowler's position, encourage ambulation, monitor for CSF leakage, apply a warm compress. Correct answer is option C, monitor for CSF leakage. What is the classic sign of peritonitis? Rebound tenderness, hematuria, jaundice, constipation. Correct answer is option A, rebound tenderness. What is a major side effect of long-term corticosteroid use? Bradycardia, hypoglycemia, hyperkalemia, immunosuppression. Correct answer is option D, immunosuppression. Which is the most important assessment after thyroid surgery? Ability to swallow, neck dressing, airway patency, temperature. Correct answer is option C, airway patency. Which electrolyte imbalance lead to tall peak T waves? Hypernatremia, hypokalemia, hyperkalemia, hypocalcemia. Correct answer is option C, hyperkalemia. What is the priority nursing intervention after a thyroidectomy? Monitor blood pressure, assess for signs of hypocalcemia, elevate the head of the bed, encourage coughing and deep breathing. Correct answer is option B, assess for signs of hypocalcemia. Which sign indicates early hypoxia in a post-operative patient? Cyanosis, bradycardia, decreased respiratory rate, restlessness. Correct answer is option D, restlessness. Which of the following patients should the nurse assess first? A patient with a wound infection, a patient with a mild cough, a patient with acute chest pain, a patient with a post-operative fever. Correct answer is option C, a patient with acute chest pain. What is the primary concern in the first 24 hours after a burn injury? Infection, electrolyte imbalance, fluid volume defect, fan control. Correct answer is option C, fluid volume defect. What is the most important nursing intervention during thrombolytic therapy? Maintain NPO status, monitor for signs of bleeding, elevate the lower limbs, encourage coughing. Correct answer is option B, monitor for signs of bleeding. Thanks for watching. Subscribe to the channel for the latest informative MCQs.